I try to warn them because it's potentially very explosive to work with couples. So I say to them at the beginning, it's very possible that as we talk, you're going to learn things about each other that you didn't know. And although some of them may be upsetting, that's a really good thing, because it means you're starting to do something different. You're starting to be honest. You're trying to confront some of your problems. So there's a contextual aspect to the therapy that I think is really important, which is treating it as as something that the two of them are dealing with. Early on, we also, though, focus primarily on the drug or the alcohol use, because a lot of times the spouse is saying, I didn't cause this. It's not my responsibility, and it's not my problem, and I'm not even sure why you want me here. So I really emphasize the fact that they're both affected by it, and probably their relationship has been affected, and that she or he probably has tried to do a lot of things to cope, and some of them have been helpful and some of them haven't. So, in no way am I saying it's that the spouse's fault. So the context is important.
Well, speaking of good outcomes, in just a minute we're going to watch a session that you did with a young couple. Mm-hmm. Can you set it up for our viewers and let them know just what they might want to be looking for in the way that you worked with this couple?
Oh boy.
And what you were hoping to do, kind of in a...
Yeah, well, this was a couple who had alcohol and marijuana problems, has never had any kind of...
Both used?
Both of them have both alcohol and marijuana problems. They'd never had any kind of treatment at all.
Okay.
So my first goal is to have them have the sense that this is a good thing, not a bad thing. So it's a very basic goal.
Engagement.
Not just to engage them with me, but to have them think that maybe therapy could be something that's helpful. I wanted to do a little bit of basic assessment, and then I wanted to try to look at ways that they were interacting around the drinking and the drug use, and see if I could identify any, get them to talk at least about some high-risk situations and coping strategies, and to help them think about how they could talk to each other about these things and try to work on their communication a little bit.
Right. Let's watch you work.
Okay, thank you.